speakers. Okay. For those of you that are hanging in, good job. We're almost done. I know a couple people have left or had to leave or whatever.
Alright. So you all have heard of catheters, right? Those tubes that basically channel urine out of your body after major surgery. But what if I told you that although they may be convenient, they carry a risk, a major risk, a risk that I've seen even become deadly. I will explain how unnecessary catheterization can have devastating effects on the patient, and some of these effects can, like I said, lead to death. First, I'm going to talk about CAUTIs, or catheter-associated urinary tract infections. According to the Center for Disease Control, over 30% of infections reported in healthcare facilities are due to urinary tract infections of all kinds. UTIs are basically when your bladder and your urinary tract infection is invaded by bacteria. Bacteria that can cause inflammation, damage, and even spread all over your body. Unnecessary catheters happen when the caregiver is unaware that the patient has a catheter. This can happen when a patient transfers facilities or when healthcare officials have miscommunication, whereas they are scared to even ask the patient if they have a catheter, which is never a good sign, because if you leave it in too long, it can have effects. Most of all, you have to have a diagnosis in most healthcare facilities to even have a catheter. And when I say that, the diagnosis I mean is maybe like skin breakdown, where urine causes more effects than if you didn't have a catheter. Bladder cancer is another one, where if you have cancer of the bladder and you're not able to filtrate your own urine out of your body. Regulations are really strict in most healthcare facilities. Well, how do I know this? I work at a healthcare facility as a CNA. I actually care for catheters if patients have them, but we pull them after 24 to 48 hours after they get to our facility because they don't have a diagnosis. And I wanted to share a story with you guys. I once had a patient who came because she fell and broke her pelvis. Now, if you know anything about that, it makes it hard to be mobile because your pelvis is attached to your legs. So it was hard for her to get to the bathroom. She came with a catheter. And, that catheter was convenient. She didn't want to let it go. But she had no diagnosis to make sure she could have a catheter. She didn't have a need for it, basically. So even though she refused, they did talk her into pulling the catheter. And when I say catheter, there's many types of catheters. Two of the most prevalent catheters are Foley catheters, which is a long, enduring catheter where it's rubber that goes up into your bladder. And then also a straight cath, which is also a thicker, more rubbery plastic that gets taken out after you take the urine out of your body. Let me tell you about some of the effects that can make CAUTIs devastating. Urinary tract infection associated with catheters can cause debilitating circumstances. They can cause lengthened hospital stays, including what makes it that long is confusion. It can cause major confusion. It messes with your brain chemicals. You can forget where your car keys are if you know how to drive, where you are, what you were doing, and that's a red flag to healthcare providers, meaning that you can no longer take care of yourself. Another reason is extensive testing. You have to have a urinalysis. We have to find out what kind of bacteria is associated with your UTI so we can treat it. And then, of course, treatment courses. We can do it pill form, we can do it IV form, or we can do it injection-wise. It can also increase healthcare costs. The American Nursing Association states longer stays in hospitals average about $2,000 to $3,000 a night. And expensive testing, like the UAs, cost $200 to $300 every test. This disease can cause morbidity and also mortality, like spreading diseases. When it spreads in your body, it can move up your ureter and into your kidneys, which causes it to go into your bloodstream, which is causing overwhelming infections, which causes sepsis, and then you ultimately pass. There are several reasons why catheters are associated with the illness. Foreign instrument, it's not the same body composition, improper care, poor cleaning, not cleaning the catheter that's coming out of your body, and also pulling at it, causing infection to invade in the scars that you cause in your urethra. Unnecessary catheterization can lead to death or other devastating effects on the patient. I hope you have a better understanding of CAUTIs and know what to look out for in the future.